We're back with another Dear Mayor project, and here to tell us about the letter he's written is Dr. James Misak. Dr. Misak, maybe you can give the folks an overview about what they can find in your letter.
Sure. First of all, I'm a family physician with the Metro Health System, and I'm the medical director of the Metro Health System's Institute for Hope. HOPE is an acronym that stands for Health, Opportunity, Partnership, and Empowerment. And it represents Metro Health's commitment to address the social, political, and economic conditions that impact the health and well-being of our communities, which we collectively refer to as the social determinants of health.
And what do you believe is the primary issue that Cleveland's next mayor should address?
Well, I would offer two primary issues for the new mayor to address. First, increasing health insurance enrollment among Clevelanders, and secondly, building a more effective and equitable public health infrastructure that is committed to addressing systemic racism, reducing health disparities, and improving community health outcomes.
Now, can I ask, what do you think is sort of the top priority, top thing the mayor needs to do about this issue?
Well, I would like the mayor to lead a public awareness campaign to encourage Clevelanders who are uninsured to enroll in Medicaid if they're eligible, or to obtain health insurance through the healthcare.gov marketplace if they are not. Regarding the Cleveland Department of Public Health, I would like the new mayor to prioritize medical and public health expertise in its leadership. And I would also like the new mayor to work to secure adequate, flexible, and sustainable public health funding from all available sources, including the city budget, of which less than 2% is currently allocated to public health.
Wait, less than 2%?
Yes.
Wow. Well, one more. That's really surprising. Just one more question, and I think I may know the answer to this. But why did you participate in the Dear Mayor project?
Well, I participated in the Dear Mayor project because the ongoing tragic loss of life from lack of health insurance and access to health care was made much worse by the tragic loss of life and health from the COVID pandemic. I believe that our elected officials, including our mayor, must act to ensure that Clevelanders have access to needed health care. I also believe that they must act to ensure that Cleveland has a robust, professional, and adequately funded public health system that is capable of responding to the next infectious disease pandemic and to the current ongoing public health crisis caused by systemic racism.
Well, Dr. Misak, thank you for sharing that overview with us. And now that you've had a chance to listen to it, why don't you read his entire letter and get a great idea of what some of the ideas he has that he'd like the mayor to embrace and move on. So thank you again, Dr. Misak. We appreciate it.
Thank you.